Are really feeling the pressure.
No thanks, I'm just interested because the idea of the swift movement on the oxygen had to do with trying to move more patients. I was talking to Professor Jeremy Nell, and he was telling me that for the past day or two things have eased off a bit, that they were having empty beds.
Wow.
And that they were also able to deal with a turnaround time of 2 to 3 days for PUIs, and so it was quite hopeful. And I was very interested. So we're just going to be taking a quick round to check how the rest of the other hospitals are doing, because the issue really, as I think we discussed before, is the admitting hospitals that become a blockage. And once you open up this side, then you can actually allow people to flow quicker, and so that's what we want to try and make sure happens. So we're gonna be in touch and see what's happening. But I'm glad that this one is moved, Dr. Naidu. I'm glad that it has moved, and certainly, Dr. Wilkinson, looks like you're having fun here. Yeah.
Emergency coordination, yes.
Yes. I think from the last week. Emergency coordination, MEC knows what that's all about as well. Been running a bit. Anyway, that's fine. I think for now, I just wanted to get a sense as to what's happening. Do you want to bring anything else, MEC?
Yeah, I think it's just to indicate that we are finalizing some of the contracting for the volunteers so that they get remunerated in the process. And also using the database that we have, we are going to bring more staff actually to assist in terms of the shift work that needs to happen. And we had a glitch on the EMS situation, which I'm hoping that it has been resolved, because we also have got a stationed EMS vehicle who's supposed to help with transporting patients in and around from different facilities coming to the site. And I think from last week we had almost 20 how many patients that have been, I think last week we had 40.
We've had 21 admissions.
21 admissions, yeah. So it's something that we said we're going to start small, so that we see when it gets well organized how we are going to upscale it. We are clear that by the time we get to what we call a peak, which will be in a month's time, this place will be up and running and as a well-oiled machine. But I think we'd like to appreciate, the work that has been put in by the clinicians, and all the work that the people who have sponsored the concentrators. We are also getting more concentrators from the site, procuring them to make sure that we are able to cover, this aspect. So this is one of the things that we want to do, that we completely make sure that, NASREC becomes fully functional and able to alleviate the pressure from the facilities around the south of Gauteng. And it might extend to even the side of West Rand and the side of Sidibeng, depending on our capacity. But as of now, we are doing quite well. With pressure, with stress, with challenges, we must say nothing is smooth. Nothing is smooth, so we just have to continue to respond on real time to all the challenges that comes up. But yeah, I think it's work in progress.
No, thank you very much. I think MEC, if you feel the pressure, then I think you're on the right spot. Because I think all of us can feel that. First, let me then say thank you to you guys, the clinicians. I know you guys were feeling quite a lot of pressure. And the last weekend, I did hear that you guys decided that you were going to cancel the weekend and started sorting out a few things quickly. Yeah, and that we appreciate. And I want to say to you that you have a plan, then we have got interventions. The plan is what we think must happen. The intervention is what you do to respond to the changing situation as the pandemic is showing its different pressures. So you can never know for a fact what's going to happen, but you must be ready to respond as soon as things go wrong. And that's why now what we do, we just call anybody to find out, hey, what do you see there, what's happening, just so that we get a sense, because there's no formula, there's no textbook for this thing. There are some certain basics are in place, but the day-to-day action is what really makes a difference. And so whenever you, as clinicians, feel the pressure, you need to make sure everybody feels it, so that we must respond. No, that's for a fact.
Keep your phone on.
Yeah. You know, my phone is on.
Yes, I know.
Yeah, you know. So, and don't feel shy to call, because when you're dealing with this is an emergency, it's a crisis, so there's no protocol here. There's work. And as long as you understand that, then there's no problem, because the key issue is that the whole plan was there to put up all the oxygen pipes. But as you see every day now, someone can be looking well or mild, and they turn just like that, and you need to put them on oxygen. I know this now from personal experiences. We've dealt with a few people, even people that are close to me that I know. So what happens is that it should be possible to go and connect somebody to oxygen when you think so, as a clinician. And that is what you must never be frustrated about. And that's, for me, the main thing for what's happened here. When people came to the hospitals, there's been a feeling that the Gauteng hospitals are blocked now, they're full. Actually, I think what we need to do is to move this line very quickly, because from what I can see, two things are actually causing us a delay. The one issue is the delay, how long it takes to get the results, and therefore how long to keep the patient as under investigation before we move them on. Secondly is availability of oxygen. If we can make sure that, therefore, you don't have that pressure, then I think we'll be fine. Now, my sense already, MEC, was that that feeling is there now, that we're quite ahead of the surge, in the sense that we don't have yet NASREC full. And even if you had to get pressure in Bara and Helen Joseph and so on, that pressure can still be absorbed by Bara. With the 10 days, Dr. Naidu can actually absorb 25 patients every day for the next 10 days. You'll still have enough space remaining. So that means you can actually even take more. And if you took 100 patients every day for the next 10 days, then you will still be able to manage the situation. So that's why I think your point now is important for me. I was going to ask the question anyway, when are we converting the volunteers to be sessional, depending on the arrangement? We discussed that, of course. I know that you, as province, are working on that. So I think you should also feel comfortable that if you recruit volunteers, pass them on to the HR. You recruit them, pass them on to the HR for two reasons. One, everyone that works here should be remunerated, and no one should feel that they can come and offer, except those who want to, because others are working somewhere, they don't want to, they just want to come and be part of the experience. So that's fine. But for those who are not employed somewhere and they're available, then of course we are ready to absorb them. Because the real challenge was getting people out of the database to come and join us. And of course, we need a very short employment turnaround time. So you don't get someone here, come back on next month. By next month, the surge will be over, so we won't be needing them. So I think you need to just make sure that 24-hour turnaround time on employment. And I'm also glad that I had quite a lot of discussion also with the NHLS, and I'm happy that your situation with the turnaround time on the tests has actually been sorted. And as I was saying, Professor Nel was saying to me, they are fine now. They've got no problem with the turnaround time. So I think at the end of the day, what we're dealing with here is a situation where, as the department, we must stay ahead of the surge. We're watching and looking at the trends, and certainly I think in the country, Gauteng is still at the top of the rate of infection. KZN is taking over now, and therefore we're going to be discussing with them how to move ahead so that they don't get caught up with the numbers. It should be possible to make sure that whoever the patients that they have to admit, they don't have a challenge with beds, with oxygen, and that the turnaround times also are reduced. With all of that, I'm quite comfortable with the approach. Our clinicians are quite on top of the game, and they've got good enough experience, and we can see the impact. And so from that point of view, I think we're going to get somewhere. So today, basically, what we are really up to is to just see how things are kind of tying up in terms of additional beds being available, so that no one should be turned at the gate to be told that there's no bed available for you. There are those who may not be admitted. That's because of the doctor's decision. So when the doctors decide that you don't admit the patient, that's it. That patient will not be admitted. And so it is not necessarily should not be because there's no space. It will be because the judgment, the clinical judgment is that you're going to be treated somewhere else, not in the hospital. So I'm quite comfortable with that. And I also think that the reduction of trauma patients is a huge advantage for us. It's going to help us to deal with the next few weeks. And so that's it. We'll be going around just to make sure that Gauteng is able to show readiness. And we've got a team that you must have their number as well. If you guys feel you have a problem, they must also come and support you. They are the emergency intervention team, which basically deals with the infrastructural issues. They were here when you had to deal with the thing on the Saturday with oxygen fittings. That group will always come in just to unblock certain areas, but they're actually helping the MEC and the department on the increasing beds in all the hospitals. Whatever we thought at the beginning was necessary, we're going to have to open up and increase the numbers more so that there's never going to be a time when there's pressure on any hospital. So that team will continue to do their work. But in the meantime, I want to say thank you. Thank you to all of you, the clinicians, the nurses, the doctors, the emergency rescue services, and the management, as well as the provincial department. I can see that you are really beginning to gel together. It happens like this everywhere. Until the surge hits you, you don't know how to behave. You will only know when you're actually in the heat of it. That's the experience I got when we were dealing with the Western Cape. And by the way, MEC, you can't run out of beds completely. The private sector, whilst it's got its own beds, but we've got a standing agreement that you'll shift to the private sector. Any patient, particularly for high care and intensive care, you'll shift them. And those patients will be dealt with on the basis of your decision as to who goes to ICU. It won't be private sector that say, we take this one, we take that one. It's the public sector doctors who will refer. That is when we're running out of capacity. So there's still room there for additional expansion. So I want you to just know that we're here. If there's anything, we're here. We want to do our best to make sure that you just focus on the patient. Don't worry about all the other logistics and management issues. If you don't feel it, just shout. We'll then move and respond. And so that's for me the key issue. I'm going to be visiting the Eastern Cape later on this week. Right now, it's Gauteng, Eastern Cape. Western Cape, it's a bit stable. They are now used to the numbers. So I think the situation there, not that everything is fine, but I think it's less unstable than what we're doing now, what we're having here. And from what I can see, Western Cape is going to be Gauteng, and then soon Eastern Cape will stabilize, and then Gauteng and KwaZulu-Natal. It's turning out the model the other way. But nevertheless, the numbers still are going up, so that's still important, that the message must still go on. Masks for everybody, and the sanitizers, washing of hands, as well as distancing as much as possible. People must focus on the real information. So this was just to get a briefing, so we'll just take a quick walk around. Thank you very much.
We come out of that state report to go straight back to the State Capture Commission.